I've had multiple experiences that have really solidified my desire to pursue a career in nursing. From the time that I was little, I've always loved watching medical shows, all the way from Doc McStuffins on Disney Channel to House and Grey's Anatomy as I got older. I loved watching these people really dig in and nerd out about their patients and figure out what was going on and help them and problem solve. That really pushed me as I got my CNA license and got my first job working in a hospital as a patient care tech. Pretty early on in that job, I was speaking with an RN one day. I think we were in the elevator, and I asked her, what does your shift look like? How do you fill the 12 hours? And she listed off the more basic things, passing medications, doing assessments, fulfilling orders. And then she said that the rest of the time really is problem solving. You look at how your patients are doing, you're looking at labs, all this information, and you work with the clinical team to address those problems and help them throughout your shift. And I loved that. I love that perspective about how working in the medical field in any capacity really is about finding those problems and addressing them so that patients, they can compound and patients can get better faster and get the help that they need. And that is something that I absolutely love and want to have the knowledge to be able to nerd out about those things and to give the best possible care thanks to my training and to solve those problems one by one. As I've thought about how I can contribute to the mission of the Church of Jesus Christ as a registered nurse following graduation, I think a lot about my time working with hospice patients. I remember this one specific man who he was on the floor for a few days, which was pretty rare, and his family all gathered round, and it was very interesting going into that room and knowing that, his family were there to preemptively grieve the loss of this great man in their life. But you could also tell that they knew the plan of salvation. They knew the gospel of Jesus Christ, and while it was sad that this loved one, was passing away, they knew that this was not the end and that they would see him again. And I loved that perspective, and I loved that peace and hope that was in that room. And it was a stark contrast to patients who did not have that knowledge, who didn't have that perspective. And so that is one thing that I hope that I can contribute, is by giving a piece of that perspective, by allowing there to be calm so that the Spirit can testify to these people that they have a loving Heavenly Father, and to be an instrument in the Lord's hand to let them feel that, so that can plant a seed to one day that they can remember that they had heavenly help along with the help here on earth in their time of need.